Now we look at another branch of pharmacology, which is related towards treating respiratory tract diseases, and this one is basically asthma. So everybody here should know what asthma is. Okay, asthma is basically these are your free respiratory airways. So in asthma, they are becoming constricted, and sometimes you're having lodging of fluid in those airways, and this is where oxygen is supposed to lodge, not fluid. Do you understand? So you have a lot of issues. So pharmacotherapy is what we can treat it. So they can call it asthma bronchial, they can call it bronchial asthma, still the same thing. So it's just a step-by-step approach to all the drugs that you actually use in treating this condition. So let's have an introduction to it. That's a recap of the pathophysiology. You should know that asthma is a chronic inflammatory airway disease. So it's coming as a result of things have been neglected for a very long time, and it actually got to this stage. And your bronchioles are actually hyper responsive. They are triggering too much. So what is causing that include things like histamines, the leukotrienes, the prostaglandins, cytokines as they are being released. They are causing constrictions, they are causing inflammation, they are causing allergic reactions. You understand? So of course, the treatment, you are trying to target the actions of all those things that are causing inflammation and constriction. So what are the different drugs you use? For the drug class in asthma therapy, we have drugs like the bronchodilators. So we have the short-acting ones like salbutamol, terbutaline. We have the long-acting ones like the salmeterol, the formoterol. The anticholinergics, this is salbutamol. Anticholinergics will have drugs like the ipratropium. This is ipratropium. Okay, we have the tiotropium. Then those ones, they block muscarinic receptors, methyl-xanthines like the theophylline. Okay, so the ones that block muscarinic receptors, they turn constriction into what? Dilation. Do you understand? The next examples, we have the drugs that will be against inflammation. So drugs like the beclomethasone. So beclomethasone, we have the budesonide, we have the fluticasone. So they are first line for persistent asthma. They reduce inflammation. So systemic corticosteroids too, like the prednisone, we have the methylprednisolone. We have the leukotriene receptor antagonist, like the montelukast and the zafirlukast. Okay, they block leukotriene action that would have led to inflammation and bronchoconstriction. Well, the mast cell stabilizers like the cromolyn sodium. Okay, we have nedochromyl. So biologics, we have drugs like the omalizumab for allergic asthma. We have the mepolizumab, we have the reslizumab, we have the benralizumab, so the dupilumab. Okay, all those ones are basically to what? Calm down your immune system. If your immune system is hyper reacting, okay, calm it down.